selective serotonin reuptake inhibitor. This medication basically we use for depression and anxiety. SSRI inhibit the serotonin uptake and elicit the antidepressant response. As I told you, this medication may need if the patient have depression and anxiety. The potential for medication interaction is high, and complete medication assessment must be obtained and evaluated. The nurse should inquire about the use of herbal therapy. So SSRI with herbal therapy is not a good choice, especially St. John's wort. This is the question NCLEX would like to ask. Which herbal medication is not too good together with SSRI? Answer is St. John's wort. The common side and adverse effect: patient complain nausea, vomiting, cramping, and diarrhea, dry mouth, and also central nervous system stimulation include akasia, means restless, and agitation. Here we see some example. Selective serotonin uptake inhibitor example is citalopam, escitalopam, fluoxetine, then paroxetine, sertraline, and also vilanzodone. So the name of this medication is important for NCLEX board. At least citalopam, escitalopam, paroxetine, sertraline, and fluoxetine. So you see the sertraline, other name is called Zoloft. Fluoxetine, other name is called Prozac, and paroxetine, another trade name is Praxil. So all of this SSRI common indication is anxiety, depression, OCD, and PTSD. OCD stands for obsessive compulsive disorder, and PTSD stands for post-traumatic stress disorder. So we can say more medication is called serotonin norepinephrine reuptake inhibitor. This is selective serotonin reuptake, but is norepinephrine. So these groups of drugs we use if patient has anxiety, depression, or any neuropathic pain. Most common medication we use duloxetine or venlafaxine, most two commons use drugs. Other name venlafaxine is called Efoxol. So another atypical antidepressant like buspirone, right? At least this name you have to know for the board exam. Atypical antidepressant. The side and adverse effect continue. So increase the sweating, blood pressure change, means patient develop hypotension, photosensitivity, insomnia, somnolence, means sleepy and feeling drowsy but not sleep, apathy, nervousness, headache, dizziness, weight loss and gain, decreased libido, apathy, tremor, and also involuntary activities like seizure. So what are the nursing intervention? So it is super important for NCLEX board. The nursing intervention for psychiatric medication. So we have to monitor for sign symptom of serotonin syndrome. Is the easy way to explain. But also it is important to educate your patient if my patient need to take SSRI. So we educate patient to take medication as prescribed, do not discontinue or chronic dose without speaking with a doctor or provider. We notify the provider if using herbal supplement or over-the-counter medication. Let me read it. We monitor vital sign because SSRI can potentially lower or elevate the blood pressure. Monitor the body weight. Initiate safety precursor, particularly if dizziness occurs. Administer with a snack or meal to reduce the risks of dizziness or lightheadedness. The client is instructed to avoid alcohol. Monitor the suicidal client, especially during improved mood and increased energy level. The client taking fluoxetine and bupropion is instructed to take medication early in the day to prevent interference with sleep. For the client on long-term therapy, monitor the liver and renal function test result. Alter the velos may occur, require the dose adjustment. Monitor while blood cell and neutrophil count. The medication may be discontinued if the level fall below the normal. If the priapism means painful prolonged penile erection is occur, the medication is with the health and also primary healthcare provider should be notified. So what is priapism? Priapism means, imagine a patient has a sickle cell anemia. Sickle cell anemia patient also have priapism, or if anybody took for a prolonged time selective serotonin reuptake inhibitor, they can face priapism as well. So painful, prolonged penile erection. So penis is erect because of increase the blood supply to the organ. And during the time of any kind of sexual intercourse, but and definitely, and blood supply increase and it is erect. But if you imagine blood supply increase and it's erected and not blood return to the heart or venous return is stopped, that times penis is still keep erect and it would be painful. And sometimes patient lost the penis. It is one of the emergency, especially sickle cell anemia patient. And second, the client is informed about possibilities of decrease the libido. Reinforce the instruction to the client to change position slowly to avoid hypotension effect. Also caution the client about photosensitivity and to take measures to prevent exposure to sunlight. Educate about potential for discontinuation syndrome if the medication stops suddenly rather than trapped. So it is when time will come to stop, it is good to stop gradually, not suddenly. The syndrome is characterized by gastrointestinal distress, behavioral or perceptual audits or movement problem, and also speech disturbance. So it may take, it is also important, educate your patient. Most of the psychiatric medication may take weeks to get the desired effect of medication. Many psychiatric medication increase the risk of serotonin syndrome, and notify provider of the following sign symptom if we see, like hesitation, fever, diaphoresis, tremor, tachycardia, nausea, vomiting, and muscle rigidity. Let me read it. Be aware of potential for serotonin syndrome, characterized by elevated temperature, muscle rigidity, elevated creatinine phosphokinase, shortly called CPR, right? And these risks greatly increase when SSRI are given with monoamine oxidase inhibitor. So SSRI and MOI together is dangerous, or SSRI or St. John's wort is not safe. Do not take SSRI or MAOI together. Do not take St. John's wort or SSRI together with psychiatric medication together is not good, as this increase the risk of serotonin syndrome. Reinforce the instruction to the client that over-the-counter cold medication can increase the likelihood of serotonin syndrome. In pregnancy, consultations with an obstetrician is recommended regarding taking this medication. So monitor the medication response in children, adolescents, and older clients closely, because response may be different from an adult. And also psychotherapy should be encouraged.